Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I am the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador COVID-19 update for today, Monday, December 7th, 2020. I'd like to begin with some very exciting news. I know many of you are interested in the latest information we have on COVID-19 vaccines. Newfoundland and Labrador is one of the 14 vaccine distribution sites Prime Minister Trudeau just announced. Thank God. Next week, the Health Science Centre in St. John's will receive 1,950 doses of the Pfizer vaccine. It will be distributed there, and the week of December 21st, we will receive another shipment. We are currently participating in a logistical dry run of the delivery of the Pfizer COVID-19 vaccine. This dry run is coordinated by Public Health Agency of Canada, and the exercise will see 2 thermal shippers without the vaccine containing dry ice and a data logger shipped to this province. The thermal shippers are expected to arrive in the province on Wednesday or Thursday of this week, where they will be received by provincial officials. This is big news for the people of Newfoundland and Labrador, and for the country, and indeed the world. Hope is on the horizon. Yet as new cases of COVID-19 are reported, it bears repeating and emphasizing. Please follow the public health guidelines. We're not there yet. The safety measures Dr. Fitzgerald and her team have put in place are proving effective. Wear a mask, keep your distance, and wash your hands. Please download the COVID-19 Alert app. It's a helpful tool in a toolbox. For the people in Harbour Breton, I know anxieties are running high right now. Your mayor and town council are working closely with Minister Lovelace, Central Health, and other government officials. My office is also well connected to the situation, and I'd like to thank everyone for their hard work. Please know that every measure is being taken out of abundance of caution to protect your safety and well-being. And that's my number one focus at all times, the health and well-being of all Newfoundlanders and Labradorians. The same can be said for many people across this province, local businesses working hard to ensure folks can safely shop, pick up essentials, or even enjoy a meal, all being COVID compliant. The local economy rests on public health. It is public health. People's livelihoods depend on robust safety protocols being practiced by all of us. So it's important for us to do what we can to support our local businesses. You can shop local without even entering a store, by calling to place an order or doing so online, or shopping there in a COVID-friendly, compliant fashion. We are very fortunate to be in Alert Level 2 here in Newfoundland and Labrador. It means that we can enjoy a fairly normal life, despite the challenges, but following COVID-19 guidelines. The measures Dr. Fitzgerald and her team have put in place to avoid a full lockdown that we're seeing across the country are serving us well. To continue to protect that, I am announcing today that the temporary changes to the Atlantic bubble will be extended. There will not be any changes to Dr. Fitzgerald's special measures order regarding travel from within the Atlantic provinces. The same goes for the borders in Labrador. This situation will be maintained for the next month, at which point we will provide another update. This means the 14-day self-isolation requirement for people entering the province from the neighboring Atlantic provinces will continue throughout the holiday season. There's still an option to apply for earlier testing to shorten that period if required. Stay safe, Newfoundland and Labrador. You're doing well, and we will continue to get through this together. Take care of yourselves and each other. And with that, I'll invite Dr. Fitzgerald to give today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today on what is a very good news day. Since the media advisory yesterday, we have no new cases of COVID-19 in our province. There have been 2 new recoveries since yesterday, leading to 28 active cases in the province. The total number of cases so far in the province is 351, and we have tested 64,586 people. We are still investigating cases in Central Health from over the weekend. Initial inquiries that we have done, that Public Health has done, have not revealed a source as yet. Regional public health officials are continuing to trace back to try to determine that source. In the meantime, we are asking that anyone living in Harbour Breton and the surrounding areas to take some extra precautions, to stay home as much as possible, to avoid entering stores or establishments outside of the community, and to avoid holding gatherings for now. Central Health has established a mobile testing site in Harbour Breton. If you have symptoms, even if they are mild, please stay home, isolate away from others, and call 811 or go online to do the assessment to arrange testing through this mobile site. No matter where you are in the province, if you have a symptom of COVID-19, you should call 811 to arrange testing and stay home. We cannot take the chance that a mild fever or sore throat is the common cold. We can only identify and contain COVID-19 if we know where it is. I have concerns that people may not come forward for testing out of fear for how they will be treated either in their community or on social media. This vilification of people who test positive for COVID, as well as those traveling to our province, needs to stop. It is a significant hindrance to our efforts in public health. In the time of social media, it is so easy to vent your frustration and fears, often behind a wall of anonymity. But before you draft that message, stop and think about the repercussions. Remember the acronym THINK and ask yourself, is what I'm going to write true, helpful, inspiring, necessary, or kind? Kindness is never wasted. It is never the wrong choice. So please think before you post. What we need right now is for everyone to pay attention to their own actions. And a key way you can do that is by reducing your contacts. I know that people still have questions about contacts versus close contacts, so I will address this now. The difference between a contact and a close contact is not defined by how you know the person or your interpersonal relationship with them, but by how often you interact with them, the setting you interact with them, how close in proximity you interact with them, and how long in duration the close interaction is. Again, it is defined by people, space, time, and place. Separating your contacts from your close contacts is a conscious and deliberate decision that each of us needs to make, similar to how you decided who is in your bubble. We need to start having open and honest discussions with our friends and family about their expectations for the holiday season and take stock of how many people we interact closely with. A gathering in close quarters should only be with your close, consistent contacts. What we mean by close quarters is a home, sharing a table at a restaurant, for example. You should not attend a gathering with one group of 20 on one night and an entirely different group on another night. 20 for 2020 means that you choose up to 20 close friends or family, and these are the same individuals that you interact with over the holidays in close settings. While it is not recommended, if you do find yourself at an indoor gathering with people outside your close contacts, maintain at least 6 feet of physical distancing, and there should be no self-serve food options, and bathrooms must be well stocked and cleaned regularly. If that's not the situation, you should reconsider your choice. It has been a long 9 or 10 months that has tested our patience and determination, but our approach is working. The community is where public health lives. It is the day-to-day actions that each of you take that determine how well we contain the spread of COVID-19. We need to have all our layers of protection in place. Wash your hands regularly and wash them well, or use hand sanitizer. Wear your mask in indoor public spaces. Maintain at least 6 feet distance from those who are not your close contacts, even when wearing a mask. Be assured that this province's public health system has its own layers to protect you as well, by restricting travel into the province for essential reasons only, by requiring travelers to self-isolate upon entering the province, and by providing rapid testing and contact tracing to identify and contain any cases of COVID that make its way here. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province is 351. The commitment you have shown will continue to be the cornerstone for how we navigate COVID-19 in our province in 2021. If we remain vigilant in our efforts, I truly believe we have the ability to come out of this pandemic as a success story. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. A good day indeed. I'm going to pass it over now to Dr. Haggie for further comment.
Thank you, Premier. Indeed, it's a real sign of optimism to see the potential for vaccine being deployed in this province in a stage way for our most vulnerable people first, prior to Christmas and certainly before the end of 2020. I think I'd like to address some of my comments to Minister Lovelace's district and people of Harbour Breton and Central Health. Given the fact that the health centre in Harbour Breton has been potentially exposed to COVID-19, the employees of Central Health there having tested positive on 2 occasions, the facility is closed to visitors. It will remain closed to visitors until further notice. The facility has both an acute area, which is open for business, for emergencies and the like, as well as a long-term care facility. The staff, as under the previous situations when we had case numbers that were high, the staff have been separating so that they are run independently and will be staffed separately to avoid any risk to our vulnerable seniors that will be staying in the facility there. The staff there are all going through a program of testing. Dr. Fitzgerald referenced the testing clinic that was being set up and is running from 10 till 2, certainly for the foreseeable next few days in the community. In addition to that, should the need arise, we have rapid testing equipment ready to be deployed and in the final stages of validation prior to being moved down to the centre. This will more than likely be the ID Now PCR test, but that again will be a decision that Public Health will make over the next 24 hours or so. I think the other thing that needs clarifying, because it seems to be a source of speculation, is what we mean when we say a case is under investigation. There's nothing sinister about this. It is simply a matter of timing. We come in here to the media briefing, for example. The morning run at the laboratory has often only finished half an hour to an hour before, so we have numbers. If there are cases, we don't have any information around them other than that which we can now pass to Public Health for them to begin the process of contact tracing. And that is essentially an interview to establish the circumstances around their life and their potential exposure to the virus. So until that interview is complete, we have no real idea of the nature of the exposure or the route by which it may have got to the individual. It is simply that those items are under investigation. It is not any darker intent than that. We have gone out of our way to release information as and when it becomes available. And quite frankly, the reason when flight advisors are issued later on in the day is that's often one of the first sets of questions that are asked and answered. And then through Public Health lens, a decision is made as to whether or not a flight advisory is to be issued. And the reason it comes out then is because the decision has been made then. It is simply prompt and as transparent and timely as we can make that. In terms of the way our data is reported, we have spent considerable effort documenting individual lives, essentially, in our news releases and through the media. Those of you who look back to April of this year, when our numbers increased, will recall that we used a different system, which was just as transparent and open and a little bit more flexible from the department's point of view, in that we updated the hub. The hub online has primary care service areas, and that is where, going forward, we would like to put the occurrences of new cases. A second table underneath it will then identify, where possible, the source of those cases under the headings of things like travel, domestic travel, international travel, or under investigation. And that will be our preferred way of going forward with notifying the public of new cases and where they might be. And a link will be included in the daily news release and shared online through our webpage. This we're hoping to have up and running within the next 48 hours, but certainly there'll be a further announcement in a daily media release to announce that. With that, Premier, I think I'll conclude my comments there and hand it back to you.
Well, thank you, Minister. We'll certainly now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
Thank you. Minister, if I've understood your preamble there correctly, you said that there are 2 staff members of the health center there that have tested positive. How has that impacted the health center aside from closing the visitation? For example, how many other healthcare workers and patients are now having to isolate and get tested because of possible exposure?
Yes, one of the individuals does provide hands-on care. The other is an administrative non-patient contact individual. All of the residents of the facility have been tested, and I am informed they're all negative. There is a program going through staff who work on the same side of the shift as the care provider or work in the same environment as the other employee, and those are currently being tested. My understanding is the majority of these tests are samples have been submitted, and as you heard from Dr. Fitzgerald thus far, we have not been advised of any positives. There are still some swabs to be processed.
Dr. Fitzgerald, there's a lot of fear in Harbour Breton right now. Can you give me an idea, when you look at, obviously, a day with no new cases, having had those samples run must be good news. How concerned are you about that situation, especially because it does involve healthcare workers?
Well, certainly, anytime we have a non-epidemic case, as we've talked about before, that's concerning for us. And right now, where we are is that we can't find a source for that case. So that makes us concerned. That certainly makes us want to go back, so do some of that backward tracing to figure out where that source may be. So I understand that there would be a lot of fear in the area, and certainly, I want people to know that public health is working diligently and tirelessly to try to find this out. The testing will help us. Most importantly, for people in the area, to stay home. If you have even mild symptoms, you need to stay home. You need to contact 811 and get some testing so that we can find any cases that may be there. That's really, and try to reduce your contacts as much as possible.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, looking for some more clarification on the 20 for 2020. I've been getting a lot of questions about it, and in trying to be clear and understanding your comments today, we're not changing the guidelines right now for the informal 50 gathering if distance can be maintained. So, for example, if a business was to have 25 people for a dinner that was physically distanced, proper public health guidelines were being followed, that is still okay?
So if a business is doing it, that's still, following the public health guidelines. So what we're talking about are informal gatherings that you're having, so the gatherings that people are having themselves in their homes. That's really what we're focusing on there when we're talking about considering changing the 50 to the 20. And the 20 for 2020 is really just about focusing on having a close group of consistent contacts over the Christmas season, 20 contacts over the Christmas season.
Okay, so the 20 for 2020 would be in your house, but if it was a sit-down dinner elsewhere, 50 would be okay if distance can be maintained. I know I'm just trying to spell it out here.
So if you're thinking about a business who's hosting a wedding, for example, there are guidelines for that. That's not what we're talking about here, right? So what we're talking about are these informal gatherings that people will have in a situation where you have a business operating some kind of event. You know, they have procedures in place. They're keeping track of people who are there. They're making sure that there's hand sanitizer, and there will be consequences for those businesses, of course, if some of those rules aren't followed. So we really, it is a little bit different with regard to, the closeness and how close contact people have, as opposed to those informal gatherings in your home where that physical distancing may not happen.
Thank you for the clarity there.
Our next questions are from Mick Frederickson with All Newfoundland Labrador. Please go ahead.
Thank you. Premier Fury, since the province left the bubble and in the lead up to today's announcement, what feedback have you had from the business community on how exiting the bubble has been for them?
Most of the feedback that we've received from businesses is they understand that this measure was taken in order to protect their businesses. I think we've seen across the country, as the public, if we follow public health guidelines and COVID is maintained, businesses are able to function. If COVID is not able to be maintained and public health guidelines aren't followed, then that's when businesses need to shut down. So most of the feedback that I've received from businesses has been that they understand that this was a measure taken in order to protect not just the health and welfare of Newfoundlanders and Labradorians, but also the economy. If we can keep numbers low, then businesses can stay open and they can continue to thrive. There seems to be a recognition that if numbers rise, then there is the fear of a lockdown, in which case businesses suffer. And so there seems to be a healthy, respectful, responsible understanding of why that decision was made.
Of course, that response is also keeping in mind that it was initially only 2 weeks. What do you tell them now that it's, looking out for another month, possibly more?
The rationale is exactly the same. We're taking this measure in order to protect the health and welfare of Newfoundlanders and Labradorians, but also to help them protect their own businesses. The rationale does not change. I think we've seen that within adjacent jurisdictions that the numbers haven't materially changed all that much. I mean, we've seen in Prince Edward Island almost a full lockdown there. We don't want to go there. So this is a measure in order to try to prevent that.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Thank you. I wanted to clarify the Harbour Breton situation. What I understand, you have an administrative worker and a frontline worker there who have tested positive. Has the centre introduced any locums from outside the community, and what measures would be taken there, do you know, to take up the slack of anyone who has to isolate now?
Dr. Heggie?
No, certainly. The people who are tested positive are residents of Harbour Breton. They're ordinarily resident there. I am not aware that there have been locums in Harbour Breton, either medical or nursing. Certainly can check on that for you. Currently, Central Health advised me that their current staffing complement can deal with the number of people isolating. One of the things we have worked very hard with the regional health authorities about is what we've called business continuity planning, so that any facility run by a health authority should have a plan in place to mitigate varying degrees of staff loss. And indeed, we were running a tabletop exercise last week to determine what would happen to facilities and how we could support them were they to suffer the same kind of catastrophic absenteeism of staff because of COVID that they've seen in Ontario and Quebec. And those findings will help reinforce those business continuity plans. So we think we have mechanisms in place. We hope we never have to use them.
Okay, thank you. And I wanted to ask regarding long-term care facilities generally, is there any consideration of of tightening up the visitation guidelines for those. I know in at least one personal care home, they actually have reverted to an earlier guideline.
The personal care homes are in a slightly different arena in a sense. Dr. Fitzgerald and the SMOs determine the floor, as it were, the minimum that is safe from a public health point of view. We use that in the department and the regional health authorities as the foundation for our instructions to regional health authority long-term care facilities. But personal care homes can always layer on measures that they feel are appropriate, and you'd have to discuss it with an individual home there. We determined some time ago that were we to find ourselves in a situation where long-term care residents were potentially at risk, we would adopt a rather focused view, for example in Grand Bank and again now in Harbour Breton, rather than simply mandating something for the entire province. Obviously, if the numbers and the distribution of cases change, that view might have to be altered too. But we're looking at dealing with the Harbour Breton issue as a Harbour Breton issue in the first instance.
Okay, thank you.
Our next reporter is Linda Swain with VOCM. Please go ahead.
Hi there. The minister mentioned it, as did the chief medical officer of health, this whole notion of rapid testing. Where and under what circumstances is rapid testing being carried out?
We have a variety of tools to use. The longest established is the Gene Expert, which came in through a federal indigenous provincial program right almost at the beginning of this, and that's certainly been used in Labrador on more than one occasion. The newer rapid testing kits fall into two categories. One is really a local rapid version of the PCR test that is used at the public health lab, and the other is an antigen test, which really requires very little training and has been likened to the kind of pregnancy test or spot test approach. We have both of those last two. The antigen test kits arrived a little bit later, so we are still in the process of doing some final validation there. As far as the ID now, the PCR one, the machines are ready to run, but the actual validation of samples would require that their use in the field would have to be verified by taking another sample and sending that off to the public health lab for the first few, and I think that's about 50. Once that had been done, we would stop then labeling those tests as preliminary. If you recall, right back in March and April, until our testing here in St. John's was validated and verified by the national lab in Winnipeg, we reported our first 50 negative and our first 50 positive as preliminary until such time, or presumptive, until such time as we had word from the lab in Winnipeg. The PCR ID now would be in a similar situation, only the verification would be done in St. John's. They're ready to go.
Not having been in Harbour Breton in quite a few years now, I wanted to get a picture of what it looks like down there. So what is the capacity of the health center in Harbour Breton, and does it have a long-term care component? In other words, how many patients are being held there at any given time?
We have 6 current long-term care residents and 2 alternate level of care residents. There are acute care beds as well, and I'm not sure what other detail I could supply you with in answer to your question.
Our next questions are from Sarah Smelly with Canadian Press. Please go ahead.
Hi there. I'm just wondering about the vaccine. So, are we going to get these ultra-low temperature freezers to store the vaccine?
There are some being, yes, we're acquiring some currently in concert with, in consultation with our federal partners.
Okay, are you able to say approximately how many and where they may go?
I think the initial numbers we were getting 2, correct?
Yes, so we
Okay,
do.
so those
yeah.
are the shippers. Okay.
Yep.
No,
Okay.
not the
And-
shippers.
No,
No,
not
no,
shippers. No,
the
that's a
shippers are
trial.
completely different. The shippers are
Okay.
how they're getting here, although the vaccine can be stored in a shipper. But yeah, we have access to ultra low freezers right now, and we have 2 that are coming.
And you have 2 that'll, okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
So give me an idea how things are going to work next week when we have those first doses are going to arrive at the Health Sciences Centre in St. John's. Does this mean that the first vaccinations are only going to be done to people in St. John's, and who specifically are going to receive those?
Well, the vaccination team is still currently working on all the protocols, but it will be in St. John's as the first urban center, as the Prime Minister kind of suggested, as you know, that's where it's kind of the trial initially of the 14 centers, and then we'll look to roll from there.
So just to be clear, we still don't, even though we've got vaccine coming tomorrow or next week, we still don't know who those actually are going to actually receive those doses. We don't have those lists drawn up yet.
Oh, we have a approach, as we've suggested all along, with respect to the vulnerable and following the NACI guidelines. But this vaccine is this is new news to us that is coming this quickly. So there are protocols in place to ensure that they will be prioritized accordingly as best we can to the NACI guidelines. Dr. Fitzgerald, I don't know if you want to kind of
yeah, and there are some. Because this is not part of, it's sort of a pre-rollout, it's a bit of a work through to make sure that, that things can work properly with smaller amounts of the vaccine coming initially. There are some specifications on how we have to roll that out. I don't think I'm at liberty to talk about that specifically right now, but there will be some restrictions, I guess, on how exactly we're able to roll those 1,950 doses out.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We know the dry run was happening today in terms of what a rollout would look like of the vaccine. That process may still be ongoing, but from what we've gathered so far, how has it gone? And with the doses coming just next week, are we prepared for that?
Well, the dry run is currently happening this week, and as suggested, there would be a trial of the freezer being shipped to ensure that it can actually be shipped and received here. I believe that's scheduled to occur on Wednesday or Thursday of this week, and that's kind of a test to ensure that the vaccine can again be stably shipped here and then transferred to the Health Science Centre with appropriately checking the temperature along the way and the stability along the way. So that's what's occurring this week, and then as we get the vaccine next week, then it'll be actioned accordingly.
Okay, and with the over 1,900 doses coming, so over 900 people being vaccinated, I'm not good with math on the fly, but with that, are we expecting there to be not errors, but so much as some of the vaccines being unable to be used due to how low the temperature they need to be contained at?
Well, that's part of this.
Sorry.
Yeah, no, go ahead. It's part of the stress test, but you go ahead. Yeah.
No, I mean, we're anticipating that we'll be able to use all the doses of the vaccine that we get. Certainly, that's our intention, and we have the ultra-low freezer to store it in, and so we're hoping and intending to use all of it.
Thank you.
Our next questions are from Mikkel Fredrickson with All Newfoundland Labrador. Please go ahead.
Thank you. There was some talk of the number of cases that were related to rotational workers coming in. Have you considered any changes to the rules for rotational workers coming in from out of province?
No, not at this time. We made a few changes last week, or it may have been the week before. I don't know. Time is blending together now. But so we have made some recent changes to the requirements for rotational workers. So there aren't any more changes anticipated right now.
And under what circumstances would you possibly think of changing them again?
I think, well, I'm not one to predict, but if our epidemiology changed significantly, then we'd have to think about how we approach all of it. So, I think that would be, we'd have to make that decision when we ever get to that point.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hi. More on the vaccine. This is part of a 249,000 dose shipment to Canada. Do you have any indication yet whether that will be distributed on a more or less per capita basis? Because that would ultimately mean about 5,000 to this province.
249,000 that the Prime Minister announced earlier today, I think translates to, doing math on the fly here, to about what we're scheduled to receive.
Okay, you said, is it 1,900 doses in total?
1,900 doses, yes, yep. That's the first shipment.
Yeah.
Yep. And then another 1,900, or hopefully something to follow. Yeah.
Okay, that's great. Thank you very much. Can I ask another question? I'm sorry.
Sure.
Yes, you go ahead, Peter.
Okay, sure. I wanted to go back to the little bit of egg on face from last week. Have government departments been issued memos about Christmas parties this year to avoid any other unforeseen fallout from not setting an example?
Dr. Hagen?
We've certainly, within Human Resource Secretariat, which is now in Treasury Board, my understanding is that the staff there have suggested very strongly that there be no office parties in the building. As I said last week, we're still looking at the whole issue of working from home and what proportion of people should do that, and if so, for how long. This would be part of that. But certainly there is no intention, as I understand it within my own department, to have any on-site gatherings such as that of an informal nature, as referenced by Dr. Fitzgerald.
Thank you.
Our next questions are from Linda Swain with VOCM. Please go ahead.
You initially said that the first doses of the new vaccines will be distributed through the Health Sciences Centre. Does that mean that the vaccine will be confined to the metro region right off the bat with 2 freezers and such a small amount of doses?
So you're asking if it's going to be confined to the metro area?
Yeah, if it's being distributed through the Health Sciences Centre, does that mean that it's going to be largely to this area?
So again, we have to follow some specifications that the manufacturer have asked us to follow. And not, I don't think at liberty to say that right now, but once we we'll certainly be quite transparent about how we're distributing that vaccine.
You've indicated that the vaccine will not be mandatory, but if it requires a second dose, how will you ensure that people get it and that the vaccine is not rendered presumably ineffective?
So we have a registry that we will be using to keep track of vaccines, and so people obviously when they come in, they'll be told to come back in there at the appropriate time for follow-up and given appointments to do so, and we will be keeping track of who gets vaccines.
The piece around that is that we've tested this already, because that's the mechanism we use to record our flu shots this year. It's all electronic, and now we also have online scheduling for appointments for flu shots. Those were the 2 key elements we wanted to dry run with the flu vaccine, knowing that this would be something new for the COVID vaccine.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I just want to clarify. So the 2 freezers that are coming, are they both going to be kept in St. John?
No, not likely, but the final decisions on that haven't been made yet.
Okay. Do you guys have like I don't know, have you assembled a team or a task force to plan the vaccine rollout and possibly a priority list of who gets it?
Yeah, we announced a team last week.
Sorry.
Yeah,
Okay.
co-chaired by Dr. Fitzgerald and Minister Haggie, and involving Commander Botting, who's going to roll this out. This is, again, we were hopeful to receive vaccine in early January. This is good news for the country and indeed the province right now that we're receiving it ahead of schedule. But I'm confident in the team that we have in place that even with the limited doses that we have for 2020, that we'll be able to distribute it.
Okay, thank you.
For our final round, I will go through the registered media twice, where there will be an opportunity for one question each time your name is called. First, Peter Cowan with CBC.
I'm good, thanks.
All right, Kellyanne Roberts with NTV. Do you have a final question?
I do. Briefly before this briefing, the opposition held a briefing in regards to West White Rose. We know a lot of those layoffs are due to COVID-19 in the year of 2020. Premier, do you have any response to that?
I haven't had a chance to follow the opposition. We're trying to lead today by announcing the vaccines and deal with the public health issue in Harbour Breton. I'll certainly have a look after this is over.
Thank you.
Mikkel Fredrickson, All Newfoundland Labrador. Do you have a final question?
Yeah, I do. In the coming months, when it gets time to reevaluate whether or not to rejoin the bubble, so to speak, are you only considering options where it's for the entirety of the Atlantic province, or would you even consider creating somewhat of a mini bubble with only one or two other provinces?
I think that decision will be made at the time, depending on the epidemiology and other jurisdictions. Of course, complicating the Atlantic provinces is it basically has a regional airport, in terms of Halifax being the central between the other three provinces. So we need to kind of balance all of those considerations, but it's too premature to judge what the epidemiology will be in other adjacent jurisdictions currently.
Peter Jackson with the Telegram. Do you have another question?
Just one. I'm wondering if you are aware of any discussions or considerations being given to the extending of the Christmas school break past January and possibly into February.
Dr. Haggie, are you aware of any?
No, I have been in discussions with Minister Osborne as recently as last night over current issues. There was at no stage any discussion around changing the school calendar.
Okay, thank you.
Linda Swain with BOCM. Do you have any other questions?
I do. I got two, but I'll wait for the next round as well. What are you looking at in terms of the rollout of vaccine in 2021 in terms of numbers and when that might get started?
I'm sorry, Linda, could you repeat the question? You kind of faded off there.
Sorry, what are you looking at in terms of rollout of the vaccine in 2021 in terms of numbers and when that may be expected?
So right now, we don't have definitive numbers of how much vaccine we're going to get going forward. There's a couple of products that we are getting, and so we don't have final numbers on that yet. We certainly have a plan to roll out the vaccine as per our priority groups that we have determined, and we'll do that in accordance with the numbers that we have. So there may be, a plan is not set in stone at this point because there may be some changes coming up, right?
Sarah Smelly with the Canadian Press. Do you have another question?
Yeah. Dr. Fitzgerald, you mentioned that you had concerns that people may not come forward to get a test just because of vilification on social media, that kind of thing, worried about community repercussions. What's behind those concerns? Do you have any, have you heard it that this is happening? Do you have any evidence that this is happening?
We certainly have evidence that it happens in other situations, for sure. So not necessarily just COVID, but we have it in other communicable diseases where there may be some stigma associated with that. Certainly we have seen that people have been reluctant to come forward with COVID because of backlash that they might receive. We've also seen that people have been sometimes reluctant to be completely forthcoming with regard to contacts or with regard to activities that may have happened in during the potential infectious period because they are worried that they're going to get that kind of backlash. It's really, really important for us to remember that that COVID can happen regardless. If you're doing everything right, you can still get COVID, and we don't really know anyone's story, and we do need to make sure that we're offering support for people so that they can feel safe to come forward. And, we can only keep track of COVID, we can only contain it if we know about it. So if we don't know about it, it can get passed on.
Okay, in our final round, Peter Cowan with CBC, do you have a final question?
I do. One just sort of popped up, and that's around rotational workers when it comes to the vaccine. We've seen that travel is the main source of new cases in this province. The federal task force wouldn't have considered our unique epidemiology when they're coming up with their list. So where will they fall on our priority list?
So those discussions obviously are ongoing. We have a set of priorities of people that, are the most vulnerable, are at highest risk of severe disease or for passing on disease to our vulnerable populations. So, that's where we're focusing our energies initially. But as we proceed through the vaccine rollout over the coming months, those are all questions that we will be addressing at that time.
Kellyanne Roberts with NTV. Do you have a final question?
I do, yes. It's in regards to the vaccine. We know that the approval process for it has happened fairly quickly in comparison to past vaccines. I'm just wondering if there's any indication about the vaccine, though. Does it prevent infection or does it just mitigate the symptoms?
So the whole point of the vaccine is to prevent infection. It's to basically give your body a chance to form an immune response against this virus so that if it ever comes into contact with the real thing, it will be able to fight it off effectively and prevent you from getting sick. So that's the basic premise of any vaccine that's out there. But we do know that in some vaccines that we've had experience with some that may not be quite as effective, where people can still get the disease but may get a less severe form of the disease. We've seen that with chickenpox, for example, in the past. It's still brand new. So I guess after we have lots of people avail of the vaccine and we see what happens, I guess we'll have better answers to those types of questions.
Thank you.
Mikkel Fredrickson with All Newfoundland Labrador. Do you have a final question?
No, I do not.
Thank you. Peter Jackson with The Telegram. Do you have a final question?
No, I don't. Thanks a lot.
Thank you. Linda Swain with VOCM. Go ahead with your final question.
Yeah, this is kind of a follow-up, actually, to Kellyanne's question, and that is in terms of will those who have already recovered from the virus need to get vaccinated?
That's a good question. And I think we certainly, I don't know that we actually have an answer to that question at this point. We'll not necessarily prevent someone from getting the vaccine if they've had the virus, because at this point we don't know how long the immunity will last after you have the virus, either after you have the infection or after you have the vaccine. We really, time will tell us that. So I think certainly we wouldn't deny somebody the vaccine if they had been infected in the past. But good question, and something we will need to look at going forward for sure.
Could I just interrupt for a second? I've just realised I may have misspoken about the number of long-term care beds in Harbour Breton. It's not 8, it's 18, just for the record.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yeah, just one more. Nunavut, for example, has said that they think that the Moderna vaccine is probably going to be more appropriate for them because the shipping and storage requirements of the Pfizer vaccine make it tough for rural areas. Do you anticipate a similar situation in some of our rural areas where it might be tough to get the Pfizer vaccine out there?
Well, that's why we've engaged the military to help logistically with our rather unique geography and distribution of peoples across the province. Look, there's 3 or 4 different vaccines that are going to be coming available, and that's what the vaccine team will evaluate as to how and which ones are best to distribute to our unique populations.
Thank you, everyone. Premier, do you have any final comments today?
Yes, thank you all for joining. To the people of Harbour Breton, although it's an optimistic day today with respect to the vaccine, I know that there are significant stresses and anxieties in your community, and if you feel overwhelmed, there is help available for you. Please reach out. You're not alone. And overall, to everyone throughout the province, please be kind, be honest, and be open about if you're experiencing symptoms. Please call 811, and this is another tool that will help protect yourselves and your loved ones, and indeed the entire province as we strive towards the finish line. Thank you.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.